Hi, everybody. How is everybody doing today? If you're doing okay, give me one of these. Awesome. Awesome. I want to thank you, first of all. My name is Mateo. I am the team captain at SSP, South Slope Pediatrics. Today, you guys have made it into this online class. It's going to be amazing. We have our super nurse, Taima, who's waving right now, ready to go. We are going to talk about CPR for infant, toddler, and for adult as well as talking about a little bit about safety in the house. All right, I want to introduce you to our partners. South Slope Pediatrics has partnered with MommaTribe, this brand new amazing online community that will bring you all together. And I would like to invite Victoria from MommaTribe to give us just a little bit of an understanding of what MommaTribe is about. Here we go. Victoria, can you hear me?
Yes, I can. Can you hear me?
Hi, let me spotlight your video so that everybody can see you. There you go.
Hi, everyone.
Hi, tell us about this amazing idea you had, how it came about, and what you guys are doing.
Great. Yeah, thanks, Mateo, for the lovely introduction, and thank you for partnering with us. We're really excited to be able to help bring this class to the community. So MommaTribe at its core is a micro community platform that connects pregnant women and new moms to ready-made mom groups in their neighborhood through mobile group chat. So imagine your WhatsApp group with your group of friends. Now we will help you get into a WhatsApp group with your local moms who have kids the same age as yours. So we match moms into groups based on your neighborhood, so your zip code, and either your due date or your baby's age. We're focused primarily on kind of the final trimester of pregnancy up until, age 1, so infants. And right now we're really focusing our efforts on the Brooklyn area with a special focus on Park Slope. So if you are expecting right now, or if you have an infant and you're a new mom who would like to meet some local moms in your neighborhood at a social distance, you can sign up to join the tribe at MommaTribe.com, and that's MOMMA tribe.com. And I think that's the crux of it. If anyone has any questions, you can email me directly at victoria@mommatribe.com.
Thank you, Victoria. This sounds amazing. I think it's an amazing idea. Bringing together the community has always been a priority at South Slope Pediatrics, and I think that this is really going to change the game down there. And I want to also say that Victoria is one of our SSP moms, so yay! All right, so if you guys are ready for this presentation, give me another one of these. Show me that you're ready. Come on, you can do it. Yes, thank you. All right, so let me introduce you to our super nurse, Miss Taima. Here she is. This is Taima.
Hi, everyone. How are you all doing? As you know, I am Nurse Taima from South Slope Pediatrics. And what we are doing today is we basically wanted to give you a little course on CPR. I will first explain to you how to perform CPR in an infant child, and then we'll go step by step. So I apologize, I'm a little camera shy, but hopefully this video will help you. So basically, what is CPR? CPR is cardiopulmonary resuscitation. And what CPR does, it helps keep the blood flow throughout the body and oxygen, right? Now, studies have shown that the brain, after 4 to 6 minutes, suffers, from brain damage due to lack of oxygen. That's why it's very important for us to know how to do CPR in the event that we are found in a situation where our child is unresponsive, right? Now, the key thing, and what I always want you all to remember, is that any CPR is better than no CPR. So always keep that in mind, okay? First thing we're gonna do is I'm gonna show you infant CPR is anyone from 0 to 1 years old, okay? So from 0 to 1 year of age, let's say that your baby is unresponsive. Unresponsive is not crying, not making any sounds, just completely nothing. You're getting nothing. You're gonna tap the baby's leg to see, baby, are you okay? You're gonna move the shoulders, anything to get the baby's reaction, right? Any movement. If still there is no movement, what you're gonna do is 2 things. Number 1, if you're alone, if there's absolutely no one at home with you and you're completely alone, right? You have to do 5 cycles of CPR before you reach out for your phone, okay? So guys, the key word is, if you are alone, you have to do 5 cycles of CPR. I will go into detail in showing you the 5 cycles, okay? However, if you are not alone and you have someone in the household with you and your baby is unresponsive, the first thing we as parents do is freak out. Trust me, you freak out because you're in a situation where you're in panic, right? So we have to jump quick into action. If you are not alone, you're gonna call for help. Hey, you, call for help, whoever's in the house, dial 911, right? Then, I'm sorry if I'm yelling. Then you're gonna expose the baby's chest area, correct? Because you need to know if the baby is breathing, right? If there's any breaths. So open up, take whatever the baby has, like a little t-shirt, whatever it has, open it up so that you're able to see the chest. You're gonna do a 5-second scan. It cannot be more than 5 seconds. And how you do it is, you will expose the chest, it's exposed. You're gonna look from the head to toe to see if you see the chest rising or any movement. If you do not see this, this is when we jump into CPR, correct? You're gonna take 2 fingers. You're gonna do an imaginary line under the nipples, right? So under the nipple, right in the middle, in the sternum, you're gonna place 2 fingers and you're gonna begin pushing down 30 times. So you have to do 30 chest compressions. You will push in until you feel resistance, right? You can also place your hand on the baby's forehead to help expose the airway and begin your 30 chest compressions. So you're gonna count with me. When you're doing your 30 chest compressions, it should be 100 to 120 beats per minute. What you can do is kind of sing the Bee Gees song, the Staying Alive, the beat, the staying alive. That's what you're beating. That's what you're going to, okay? Here we go, 30 chest compressions. And you're gonna count loud because you need to remember what number you're in as you're doing these compressions. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. You have your 30 chest compressions. You're gonna keep your hand here. With 2 fingers, you're gonna tilt the chin back a little bit, the head back. So the 2 fingers go under the chin, tilt the head back. Now, for an infant, you're gonna cover the baby's nose and mouth with your mouth, okay? Here we go, you're giving 2 rescue breaths. These are called 2 rescue breaths. So 1, and you're looking for that chest rise. If the chest does not rise, simply readjust the head and give 2 rescue breaths and continue CPR, right? We're gonna do another. This completes 1 cycle. 30 chest compressions, 2 rescue breaths equals 1 cycle. If you guys wanna write that down, remember, 1 cycle is 30 chest compressions and 2 rescue breaths. We're gonna continue. Again, 30 chest compressions and 2 rescue breaths. If you notice, I keep my hand on the head, putting the nose up towards the ceiling, kind of helping open the airway as I begin the chest compressions. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 2, 3, 24, 25, 26, 27, 28, 29, 30. Again, 2 fingers under the chin, tilt the head back, 2 rescue breaths. My mouth is covering the nose and the mouth of the baby. I'm not sure if you're able to see the chest rise, but 2. And then you go back again, 30 chest compressions. Again, you're gonna do these for a total of 5 cycles if you are alone. Then after the 5th cycle, you will run, get your phone, call 911, put it on speaker, and continue doing CPR, okay? Now, I'm gonna jump real quick into choking. Let's say now that your baby is eating, right? Now we introduce solids, and even though we're pureeing and everything, still, babies are at an age where they put things in their mouth and they can choke. Their little airways are a little small, so they can choke, right? Let's say we find ourselves in a position where the baby is choking, and you notice that the baby is coughing or crying and is choking. What do? Again, other than freak out, you're gonna first grab your baby, right? You're gonna place your hand on their face like this. Do not choke your child, please. Place your hand toward under the skin and make sure that that your finger is not covering their nose. Just like this, right? Put their legs over your forearm. To do this is always best for you to kind of have a seat so that you can use your knee to help, right? You're gonna begin with 5 blows to the back. And where you're aiming is in between the shoulder blades, you see? In between the shoulder blades, you're gonna give 5 blows on an upward position. When you have the baby down, don't have them like this giving blows. No, you wanna place them down so that whatever is obstructing the airway is able to be expelled out, correct? So we're gonna do 5 of these. 1, 2, 3, 4, 5. Then you're gonna flip the baby over, supporting the head, right? And you're gonna look and see, right? Nothing. You're gonna do 5 chest thrusts, right? So the same way that we did for CPR, your 2 fingers go in the sternum in the middle under the nipple line, and you're gonna do 5 thrusts. 1, 2, 3, 4, 5, right? Baby is leaning down, face up. You're gonna look and see. You do not see nothing. You never, ever, ever put your finger in the baby's mouth if you do not see anything. The reason being is you can obstruct the airway even more and make that more difficult for whatever is clogging the airway to come out. You're gonna continue doing the 5 back blows and the 5 thrusts until the baby expels whatever is in the mouth. Now, if it never comes off and your baby now becomes limp and unresponsive, you have to place your baby back into a hard surface. Whenever you're doing CPR, you never put your child in a sofa, on a mattress. It always has to be on a hard surface so that you're able to have something firm to do CPR. If your child became unresponsive, this is when we jump back into CPR. So we're gonna do the 30 chest compressions and the 2 rescue breaths. However, if there is an obstruction that is not allowing the baby to breathe, when you give your 2 rescue breaths, you will not see the chest rise. And that's because there's something that is obstructing it. But you must still continue 30 chest compressions, your 2 rescue breaths. This is when if you're not alone, someone has to call for help. But if you're alone, you go until your 5 cycles before you reach for your cell phone and call 911, okay? Now, again, like I said, we never put our fingers in the baby's mouth. You could only, if you're able to grab it and take it out, that's the only time that you can put your fingers in the child's mouth. If you see something there and it's too close to the back, don't put your finger in there, because versus you taking it out, you can actually push it back down more and it can obstruct it. So continue the back blows until it comes out, okay? I'm gonna jump really quick into a toddler. The toddler is anyone from 1 year of age and up. And it's very similar to an adult CPR, how you would give CPR to an adult. The mannequin I have here, it's not a baby, but we're gonna pretend it is. It's the same thing. So it does change a little bit for a child who is 1 year old and up. And I want you to pay close attention to what changes. The first thing that changes is that you're not using just your 2 fingers. For this, you have to use the palm of your hand, okay? the scenario, the baby, you know, is unresponsive. You get the baby's attention. Baby, are you okay? Baby, are you okay? If you have no response, if you are not alone, have someone call 911 and begin your CPR. If you are alone, you have to do 5 sets before you get your phone and call for help. So, baby, are you okay? Baby, are you okay? Hey, you, call 911. Open up so that you're able to see the chest and see if there's any breathing, correct? If you see no breathing, you're gonna put the palm of your hand, again, under the nipple line, right in the middle of the sternum, like this. You can place this hand over, so your dominant hand should go on the baby, and the other hand over. Curl your fingers, and again, we're doing 30 chest compressions. When you're doing compressions, don't do this. I see a lot of people kind of like, no, you have to lock your hands, right? You have to put the force. You go down until you feel a little resistance. Do not be afraid. Always remember, any CPR is better than no CPR. You begin 30 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 27, 28, 29, 30. Now, for an older child, you put the hand on the forehead and you tilt the head back the same way, 2 fingers under the jawline. However, you're not going to cover this child's mouth, nose and mouth with your mouth. You're going to actually pinch the nose. The same hand that you're using on the forehead, pinch the nose and give 2 rescue breaths. So tilt the head back, this hand on the forehead, pinch the nose, and 2 rescue breaths. Saw the chest rise? You go back. If you don't, still no response, you go back into 30 chest compressions and your 2 rescue breaths, right? You're gonna do this again, 5 cycles if you are alone. If you're not alone, you're gonna continue doing CPR until help arrives. Now, CPR is very tiring, guys. So you have to make sure that if you're not alone, someone is calling 911. Unfortunately, when we're found in situations or circumstances where our child or any child that is under our care is involved in a scary scenario where they're not responsive, we tend to blank out. Make sure that you have someone call, because you will get tired of performing CPR by yourself, okay? If you're with your partner or someone else that knows CPR, take turns. While one is doing compressions, have the other one give the rescue breaths, okay? So after the first cycle of the first cycle of 5 sets, after that you switch, and then the next person will give the rescue breaths, and you do the compressions. Now, this is where it gets a little interesting. Here's our little adventurous, little beautiful children that love to discover and explore and touch everything, right? And no matter how we are at home as far as keeping everything tidied up and clean and keeping things out of the floor, kids will always find something to put in their mouth. They will always go a little deeper and get that one thing, right? Let's say that this toddler is now choking. What do you do in a situation where the child is choking? It also changes. You're not gonna do the back blows, and you're not gonna do the 5 thrusts on the chest. You're gonna actually pick the baby up, right? Now, you're gonna make a little fist, right? With this part of your fist, you're gonna place right under the sternum, right? You're gonna grab this hand and you're gonna place it over. You're gonna push in and up. It's a little difficult, but you're pushing in and an upward position, right? Because whatever the baby has or the child has that is obstructing, you want it to be expelled and thrown out. So in and up, right? There is no amount of or limit to how many you do. This is until the baby or the child lets go of whatever is obstructing the airway, or until the child becomes unresponsive. Now, again, goes under the sternum. You're gonna put this hand over and you're gonna go 1, 2, 3, 4, 5. It could keep on and on. You're gonna keep counting until it comes out, right? Or until the child becomes unresponsive. Now, if this child becomes unresponsive, we have to go back into placing the child on a hard surface, right? And we're gonna continue CPR. We're gonna do the 30 chest compressions and the 2 rescue breaths. And it's the same thing. If you're not able to see the chest rising up, do not worry. Something is still obstructing the airway, continue your CPR until 911 arrives. Again, always have someone call 911, or if the child is choking, you're found alone, you do 5 sets of CPR before you go grab your phone and call for help, call 911. Now, another thing that I did want to tell you guys is to kind of like baby-proof your house a little bit. When we have our little toddlers that are just learning how to walk, or, you know, exploring our homes. And also now, due to the circumstances that we're all living and facing, a lot of us are doing a lot of work from home, and we now are juggling many jobs and at once. Things to keep in mind is, if now that the summer is coming, if you live in a upstairs, like a second floor and up apartment, make sure that your window guards are tightly secured. They're safe, because many of us have beds next to our windows. And what happens? Kids, you know, we're working at home, from home, distracted, watching the child, but still in that 1 second, your baby's jumping on the bed. And guess what? Not to scare you, but it has happened. They can fly right out that window because that window guard is not tightly secured, right? So we have to make sure window guards are secured. That's 1. 2 is, a lot of us have the blinds. You see these the little cords. Kids love to invent with these cords. They love to twirl, you know? So imagine they're twirling and twirling and twirling. This becomes tangled on their necks. And here we go. They suffocate. So make sure that you take all those cords, roll them on up, and have them high where they can't reach them. Another thing is on sofas. A lot of us have, you know, again, we go back to working from home. We put the baby down on the sofa really quick because we're just gonna run and grab that bottle of water. Even if it's for a split second, although we should never leave our children unattended, make sure that you put pillows on the floor, because the babies are quick. They can roll right over, and it's best that they hit a soft surface rather than a really hard surface, okay? When they're walking and learning how to walk, if you have a coffee table in the middle of your living room, what happens? The corners are sharp, right? They're starting to walk, they fall, boom, they hit their heads with the corner of the tables. So they do sell some little plastics, some rubbers that you can put on the corners. I had those before for my kids, and they're helpful. Also, your cabinets, use the little safeguards so that the kids cannot get into it. If you do have detergents under your cabinets, make sure that you move them up higher where the babies can't reach them, because they're little. And what happens? They like to explore. They don't know what's right from wrong. Kids they begin to have a perception of death around 2 years of age. Till then, they don't know. They have no idea what's right and what's wrong. They're just little and exploring. So make sure that you have those cabinets secured and get all those detergents away from them. Also, if you have an infant from 0 to 1 year old, make sure that when they're in their cribs, you don't have any like stuffed animals, those bumpers or quilts, nothing. The baby should just be placed on a fitted sheet and the baby, nothing around them, because you don't want them to get, you know, to suffocate or twirl or hurt themselves with anything on it, right? What else did I want to, oh, one last thing. One thing that really gets to me, please, I beg you all to not do this. Never tell your kids that medicine is candy. Don't do that. Medicine is not candy. You want to know why? 1 split second, you can leave that Tylenol right on the counter. The baby can reach right over for it. Oh, this is candy. Drinks the candy. Now we have an issue, right? So never tell them that it's candy. Always be, forward and tell the kids it is medicine. It tastes a little good, but never associate it with medicine. It's not good for them, right? Because then if they drink, they thinking it's medicine, that it's candy. They're going to drink Tylenol and then go for the Motrin because it's candy. And here we go. We have a big problem afterwards, right? Other things is that when you guys are out, or if you're going to step out and you have someone else taking care of your child, always in your refrigerator, it's good to have emergency contact numbers, and also have the poison control number and your pediatrician's number where you're able to reach them in case there's an emergency. Because when we are found in situations like this, we blank out. Our minds just blank out. So these are just little tips, guys. I hope that they were helpful. I'm going to be here if you guys have any questions, okay?
Thank you,
all.
Taima. Thank you so much. This was amazing. I remember in one of your presentation also, you talked about magnets and how we should all get rid of these little tiny magnets from our houses, because let's say that the baby or the child ingests one or two, then what happens to the airways, right? It's incredible. And we do have some of our SSP parents who are ER doctors, and they have seen horrible stories. So we have some questions. I'm going to put you back on the spotlight. I'm going to read you some of the questions. If you guys are, if you have questions, please feel free to post them in the chat or to wave at me. We have several participants, so it's going to be a little difficult for me to find out who has a question if you raise your hand. So please write them there. So let's start with the first question is from Victoria, and she's asking, what are the foods we should avoid giving to the baby to preventing choking? I heard bread can be problematic.
So babies, one thing I would stay away from is, if you're going to give baby grapes, make sure that you cut them all up. One food that I would definitely kind of be very careful with are hot dogs, believe it or not. Hot dogs can actually obstruct the airway. And that's one of the things that I've seen a lot of kids, when I used to work in Our Lady of Mercy. That's one thing that we used to see a lot of kids choking on, like hot dogs. If you're going to give them hot dogs, just cut them up in little tiny pieces. And just remember that babies, when they're when you're introducing foods to them, and they have those cute little teeth coming out, we kind of get happy and we want to start feeding them. Just remember, they're little tiny teeth, so let's still puree our foods and still, little by little, and be very attentive. But personally, I would stay away from, hot dogs is one that I would be very careful with. Grapes is another thing that I would be very careful with. Just make sure that you chop them up really good into tiny little pieces.
Thank you. There's the next question is, do you do chest blows if the baby is coughing or if the baby is not making any sounds?
Do I do chest blows if the baby is coughing? Yes, you can help them. If the baby is, let's say 15 months old and it's coughing, you can help them by giving them the back blows to help expose it, like expel whatever that is obstructing. You could do back blows and help them.
So if the baby is unresponsive, we go back to CPR, basically.
If the baby becomes unresponsive, you begin right back into CPR. 30 chest compressions and 2 rescue breaths. Okay.
Next question is, at what age or size should we switch the infant approach to the toddler approach?
At what age? Okay, so up to 1 year old, it depends. Some babies are bigger, some babies are smaller. So if you have a smaller baby, and you can do the infant up to 1 year old. If you have a bigger 1 year old, then jump into the CPR, bigger CPR. So it actually depends on your child. If you have a smaller child, stick to the baby infant. If your child is bigger, then you go into the bigger. Perfect example is my oldest son. He was always a big kid. So for him, if he would have been 1 year old and choking, I would have definitely done the big, for a bigger kid. Versus my little one, who was very tiny, I would have done the infant.
Got it. Thank you. Next question is, how hard do you breathe for infant rescue breaths versus toddler rescue breaths?
So you don't want to go in really hard. So you're going to give a smooth rescue breath, right? So you're just going to tilt the head back and do softly 2 rescue breaths. So, right? You're not going to go. So it's a smooth, 2 smooth rescue breaths. And it's the same for an adult.
Thank you. And then the next question from Sarah is, for choking, once they are unresponsive and we switch to CPR, do we ever switch back to the choking procedure, or do we continue CPR only?
No, if your child is unresponsive and remains unresponsive, you do not go back to you continue CPR. You do not go back.
So yeah, go ahead. I'm sorry.
So yeah, so if your child is unresponsive and is completely not responding, you continue CPR. If while you're doing CPR, let's say whatever was obstructing the airway comes out and you're able to sit the child up, then you stop CPR and you still call for medical help. You know, help is on its way. You just sit the child up and have them sit until medical emergency arrives. But you don't, you know, if it's expelled, I did that once with my son. He choked on, you know, he was, 2 years old? He found a mint ball, took it, choked on it. I froze, guys, I froze. I completely froze. I've been a CPR instructor for the past 5-6 years, and I completely froze. What did I end up doing? I'm giving him the Heimlich maneuver over and over. I'm back blowing him and doing it. The mint ball had left a long time ago, but I was still doing it. So just make sure that, you know, if the child speaks to you, you can stop. Don't continue.
That's hilarious. We have the next question is from Oscar, and Oscar asks, what should we do while waiting for EMT to arrive if we have already finished our 5 cycles?
Continue. If you remember, and that's why, please remember what I am saying. You do 5 cycles of CPR and you stop those 5 cycles only if you're alone. That is just if you are alone. And you stop it in order for you to be able to grab your phone and call 911. But when you call 911, it's on speaker. You're never going to be on the phone. You're going to put it on speaker and continue your CPR until help arrives. That's the only time that you stop the 5 cycles. It's just so that you can run and get your phone and be able to call 911. But then you continue. So if someone already has called 911, you're not stopping CPR. You're going to continue CPR until medical help arrives.
That's clear. Thank you, Taima. The next question is, so Sophie says, I think I missed this. So for rescue breaths for infant, did you say your mouth should cover their mouth and nose?
Yes. So from 0 to 1 year of age, right? And the 1 year of age is because it's depending on your child's size, correct? But from 0 to 1 year of age, you have to cover the child's nose and mouth with your mouth. It has to be covered, okay? When you're giving the 2 rescue breaths, you cover their nose and their mouth to be able to provide their 2 rescue breaths. Remember, their faces are really small, so it's going to be hard for you to just aim. You have better chance of aiming through the nose and mouth.
Got it. And then for toddlers and adults, you pinch the nose.
You have to pinch the nose. So with the same hand that you're using to kind of help the airway, you're going to pinch the nose with your 2 fingers. So your palm of your hand is helping tilt the head back the same way that these 2 fingers, that's why you use the 2 fingers to help tilt as well. You put it right under the chin, not on the throat, right on the side of the chin. And you pinch the nose and you give 2 rescue breaths.
Thank you. And then we have one more question. Seth is asking, for the infant chest compressions, should they be on the sternum or just below?
You should go right on the sternum and give the 30 chest compressions.
Awesome. And then Victoria,
so it's right under the nipple line, right towards the middle, right on the sternum.
Thank you. And that is for everybody.
Yes.
infants and toddlers
For everybody.
and adults. We just switched the hand on the toddlers.
Yes, for the adults, remember, from 1 year of age up until an adult, you're using the palm of your hand right in the middle, right? Right under the nipple line, right in the middle. When
Awesome.
you're doing it in adult, since your palm is a little bit bigger, you're gonna go a little bit under the sternum. That is fine. And also, I want you guys to know that when you're giving chest compressions and you're going in, don't be afraid if you hear something. You know, it's gonna sound awful if you crack a rib or something happens. Don't worry. Continue CPR. Again, any CPR is better than no CPR because it's helping the blood flow throughout the body and it's keeping oxygen, going through the brain. Remember, after 4 to 6 minutes, brain damage begins due to lack of oxygen. So CPR really does help prevent this. That is why it's very important.
Thank you, Taima. We're gonna finish. I don't see any other questions. We're gonna finish with this little story from Victoria. She says, "This is not a question, offering a story. My son fell out of his high chair onto the wood floor head first and around 6 months of age because I didn't properly strap him in. He seemed secure and I turned my back for a second to grab his food. And you know that's exactly when it happens. Always use the straps. He was fine, but it was scary." And I have to tell you,
can I give this story?
Yes.
Right.
Now we're gonna get Dr. Kao to share his own story, if you guys don't mind.
Hey, hi guys. So when we actually went to South Carolina to finalize our adoption, Isabella and Mateo and I were in a hotel room getting ready, and Mateo was before the court hearing. Mateo was in the shower. I was sitting on the couch next to Isabella. She was here. The end of the couch was here. I turned to put the iPad away for like a split second. She decided to take a swan dive over and like bop right here. So lots of crying. I mean, I know, I have experience, so I wasn't terribly worried, but lots of crying. She had a big goose egg in the front, and then Mateo came out, and luckily for us, the court hearing was canceled, but because it was actually at Hurricane Irene, so they canceled everything, and we got the last flight out, right, Isabella? You don't remember?
No.
Yeah. So don't blame yourself if it happens, okay? Kids take front and back impact really well. It's the sides onto like 3 feet, like falling from 3 feet onto concrete to actually cause any real significant damage. But we got lucky, and we didn't have to go. We rescheduled for like 3 months later.
And this also means that this happens to a pediatrician.
It
too,
happens
guys.
to everybody. Like, it happens like that. So don't blame yourself if it happens. You won't forget the sound that it makes, but don't blame yourself.
Exactly. So we want to say thank you to Taima. We're gonna wrap this up. I want to thank everybody, and we want to thank you. Thank again, Victoria and Alexis also. From MommaTribe. Thank you so much for this collaboration. We can't wait to see what the next big thing will be for you guys. We're going to be here to support you anytime. Please let us know whatever you need. And thank you, Taima, for your knowledge and your availability. It was a great presentation. I learned a lot, and I've seen this presentation several times, but every time there is something new. So thank you again.
Welcome.
Thank you, everybody,
Thank you all for joining.
and stay safe.